So there are differences now uh, from the traditional. What is exactly I want to try to say the differences from the traditional risk management within an ERM or enterprises risk management. So the traditional risk management took a more clinically focused approach and then examined the risk individually. That's the traditional. They looked some of they focus on some of the clinically let's say mistakes, and then what they will do after that, they will examine some of those risks individually. But with the enterprises risk management, so the risk manager has a larger focus and more strategic position. And at what point it begins with the risk identification first, and then determination of some of the relative importance of the risk. So the enterprise's risk management is completely different from the traditional risk management. The traditional risk management, as we've seen, or I've just explained to you, it's pretty much focused, it's clinically focused approach, and it's examining some of these risks more individually. But at the ERM, which is enterprises risk management, they pretty much, the risk manager now has the larger focus and more strategic positions. And first they're beginning by identification of some of these risks, and then determination of some of the relevant importance of the risk. So what is the process with respect to the enterprise's risk management? We know that it utilizes steps in the traditional risk management process. The first is identify by just collecting some of those risk or data, and then convert that data into the information and make some analysis, and all that is trying to exposure to loss. And second, they have to examine the feasibility of the alternative techniques, and then they have to select the best techniques, and then after that they have to implement some of those techniques. And then after they do that, the last thing is to monitor and improve the risk management programs itself. So shifting gear now from the quality and risk management in terms of the process itself, now we're looking at the quality and risk management. So if you look back now historically, risk management and quality now initiatives were seen as separate. This is way back. But if you look at them today, quality and risk management, some of these healthcare organizations out there, so they utilize a more integrated approach by recognizing that many risk management errors are breakdowns in process, by looking at the quality rather than individual errors. So the quality management techniques, so there are two of those quality management techniques, the quality assurance and quality management. So the quality assurance itself is a formal and systematic program by which those healthcare providers or the healthcare given to a patient is measured against established criteria now. So with respect to the quality management, it's pretty much consists of monitoring and evaluating quality issues that surrounding their particular facilities and services, and then it's followed by the changes in the system itself, such as by looking at some of the scientific methods, such as some of the companies or health organizations that may use, I can say, action-oriented learning by applying some of the rapid cycle improvement once they're looking at the quality assurance and look at some of the formal and systematic programs. and then they just monitoring, evaluating some of the quality issues, and then followed by the changes. And all of this by planning it, trying it, observing the results, and then acting on it, on what is learned. Okay? So the quality management techniques now, if you look at back to some of these, what I'll call it, the researchers, way back, he knows as, his name is W.E. Deming. He pretty much using the total quality management on the systems, not on the individuals. And the Professor W.E., what he apply is he used the rules of 85-15% rules. So 85% of the problem, he look at all 85% of the problems, and he's related to the system failure, not as in individuals, but only 15% is the fault of the peoples involved. So they teach the total quality management techniques. And it's pretty much looking at the three premises now. Quality is significant, important, and can be measured. And then looking at the premises such as the people, because they are part of that enterprise's risk management. So the people are the part of the solution, not the problems. If you look at the people as a problem, then I think you're not going to be able to using the quality management techniques such as the total quality management, because he's using the rules of 85-15 rules percent. And then the last thing is changes. I've just indicated using some of the action-oriented learning by looking at changes, the fundamental, and can be managed. So the continuous quality improvement, or known as CQI process, it's pretty much used out there in today's industries such as healthcare and other businesses to improve the ability to satisfy customers' expectations. Continuous quality improvement. You see this a lot of some of these mobile companies, healthcare companies out there. And what they do exactly, they direct attentions to the fundamentals, mechanisms that drive a process or a system. And then they focus on techniques to accomplish only positive changes, and by assessing a process that leads to the intervention of that particular problems they use. And then they use of the Sentinel events, and this is one of the area that the continuous quality improvement is looking into some of the Sentinel events, such as things that they can be some of the errors that the hospitals or the operating rooms, they do wrong things to the patients. Let's say, for example, instead of maybe perform a surgery on the right leg, they just go and perform a surgery on the left leg. So they will use some of these events, and the purpose of using that is to improve or to satisfy customers' expectations. So there are 4 stages now for process improvement out there, as they've been recommended by Dr. Steven Spear, and all of these 4 stages of for process improvement. The first one is to look at the system design and operation itself, and see if there's any gap or something needs to be done to correct it. And then the after system design and operation, so the next thing is to look at the problem solving and improvement. And then once you look at the problem solving and improvement, and you can do knowledge sharing within that particular organization. You share the knowledge about the system designs and operation itself, and what are the steps for problem solving and improvement. So you empower the individuals who are working in that particular facilities by developing what we call the high velocity skills in others. I think there's a 4 steps with respect to developing high velocity skills in others. Leaders should be teachers, and leaders themselves, they need to bring themselves at the working flow and work and connecting with those individuals who they lead, and they have to lead them as a teacher by looking at the system designs and operation, problem solving and improvement, empower the employees by knowledge sharing, and develop some of these high velocity skills in others in order for to improve the process within that particular organizations and to minimize some of these risks. So there are some other quality tools from the industry out there, and some of you, I guess, maybe you have heard before, such as lean management focuses on reducing waste and eliminating errors in the process. You will find them a lot in companies that they're dealing with the logistics and supply chain. Companies like in industries that they do in the manufacturing industries that they manufacture XYZ products, they'll use a lot of these lean management tools out there to reduce waste spending over what you call ordering some of the inventories, and also they'll use lean management to eliminate errors in process that pretty much process that particular product that is manufactured within that particular industry. And then also there's this Six Sigma quality control tool out there, and it's pretty much focuses on eliminating causes of defects and errors, and it's pretty much minimizing variability in the process. And you'll find a lot in statistics the variabilities, and I think is the separations of the mean values in terms of the IRQs and all that, the mean standard deviation. Find the differences in variations among the mean value of that particular numbers, that targeting to minimize some of the defects and error within that process of manufacturing, maybe XY. Alright, shifting gear now to the barriers to the quality management initiatives. In hospitals, keep in mind that there's a clinical administrations and there's an administrative functions. There's two groups out there. So the separation of administrative functions when it comes to the continuous quality improvement implementations can be difficult sometimes. As the physicians, sometimes they pretty much tend to focus on patients, not in some of the administrative responsibility, such as billing, make sure that all the maybe medications, equipment, staff members are at work or they're available within the working facilities. The only thing they want to focus on patients and not on the administrative responsibility. So that creates some of these barriers when it comes to CQI, continuous quality improvement process within the that particular facility. Sometimes you'll find some of these hierarchical and bureaucratic structures within that organizations can make empowerment significant difficult. And in some other organizations, you'll find the lack of recognitions of problem-solving initiatives and also lack of visions of desired outcome. Inflexible attitude within the people who works within that particular organizations, and sometimes this is how it always is being done. That kind of attitude can tend to do what? To create some of these barriers to continuous quality improvement implementations within that particular facility. Shift gear now to quality improvement teams, known as a QIT, quality improvement team change agent, and as been indicated out there, that quality improvement teams sometimes may be providing continuing educations to individuals who are working in that particular facilities, like an ongoing training, and can pretty much improve the quality of services, and even it can boost some of the morale of those individuals who are working in that particular facilities, and can investigate it and recommend it improvement, and many times in conjunction with the risk managers who may or may not be a member of the team. So customer now, if we look at the customer, is key when it comes to the quality improvement process. Views the customer as central to its purpose. So it is imperative, because customer is the key, to know who the customer is first, and their importance when it comes to providing care. So the customer is always, customer is not always the patient, okay? So think about it. If you go to your doctors, you go to the hospitals, you go for a physical, you're not a patient, you're a customer. You're going there to receive a physical, let's say yearly physical, as a service. You're going to buy that service as a customer, not as a patient. So always, customer is not always the patient. So customer is the key, and it is imperative to know who's the customer and their importance when it comes to providing care. So continuous quality improvement and labor relation. So now we know that it's significant important now to the risk manager. Should make sure that any quality improvement team or other continuous quality improvement programs teams are reviewed and are deemed allowable by the NLRA. This is the National Labor Relations Act. I think it was passed way back in 1935, 1936 by looking at Wagner. I'm not sure exactly. It's the Wagner Act that pretty much gives the healthcare workers, I think, the rights to organize and pretty much to protest anything that they think is not right. So the National Labor Relations Act, so it's the job for the risk manager to make sure that they're making all these reviews with respect to the quality continuous improvement, and also the quality improvement teams, and all of these, they have to in line with the National Labor Relations Act, known as NLRA. So some teams may be viewed as a labor organizations dominated by the employer if not structured properly. That's why it's significantly important for the managers to review some of these structures, some of these labor organizations. Another reason here, I'm from South Carolina here. I think organizing labor, or what they call them unions, they are not allowed by the state law here in the state of South Carolina. But some states, they organizing laborers pretty much have a powerful, the unions, they call unions, very powerful. Okay. All right, let's shift gear now to determine the effectiveness now of risk management. What exactly, is there any effectiveness of some of these risk management in terms of the quality improvement, total quality management, continuous quality improvement, and even some of these teams quality improvement. So there is currently no research to give us a exactly answer, or that research that they have demonstrated there are some of the effectiveness of risk management programs out there. So however though, risk management programs themselves are significant importance, I have just indicated or described, when it comes to some of these adverse events do happen, and there is a need to conduct an investigation, or to investigate and implement some of these strategies and improvements to minimize the risk to some of these events. Sometimes they may or keep coming back, occurring. So program evaluation, sometimes they pose some of the questions out there, such as what are the areas of responsibility or functions defined for the risk management. And another question could be which information or data are collected and available within each of these areas of responsibilities or function. And then once you respond to some of these questions, then you can conduct some of the programs evaluation, such as the total quality management that I've just indicated in the beginning of this class, the team quality control, and even the continuous quality improvement program or process. And once you identify or respond to some of these questions in terms of what and which areas of responsibilities or functions, then you'll be able to do what? To identify and analyzing some of these risks they may be posed to your facility. So once you're collecting data and translate that data into the information, then and you can pose a question again, can this information collected, or these data can be categorized and analyzing by using systematically methodologies to derive or to come to some of the measures of the effectiveness, and to be able to control and management, and providing some of the interventions that will stop some of these events to occur. So shifting gear to use of the standards now, we know that standard must be reasonable out there. You can't just put some of the standards that they're not reasonable, and they have to be measurable and achievable. And result standards is pretty much, these are the standards that is accomplished. Okay, and activity standards, it means that by which something is accomplished. So you'll find some of these healthcare facilities or clinics or hospitals, they do have standards and guidelines and policies that they follow. And as I've indicated, some of them, the standards, they have to be reasonable, they have to be achievable, and standards, they have to be measurable. All right, so from standards now, we're looking at the evaluations tools that they can be applied out there if you want to evaluate your programs now. And the end results of all of these is the quality and patient satisfactions. So evaluations tools, they're out there. Some of them, they're looking at the root cause analysis of the particular problem that exists. And also the second tools that is out there is the failure mode, effectiveness, and criticality analysis. External evaluation, when it comes to the total quality management, there are some accreditations organizations out there, such as the Joint Commission. We have heard this, we've seen this many times. They were coming in and evaluating your total quality management or your continuous quality improvement process within your organization, and to evaluate a healthcare organization some of these risk management programs. and providing some of the accreditation process. So they were coming in during the accreditation process and evaluated if you do have any kind of program, and then maybe they were providing some of the recommendations and suggestions of what exactly you need to do. And then we do have some of the third-party payers. These are the insurance companies. They may also evaluate risk management programs within that particular organization. And the purpose to do that is to determine some of the insurability of the organization. Some of these risks, if it's possible to be what? To be able to be insured or to be covered. And sometimes when you're looking at the external evaluation, you'll find some of the benchmarking. An organization itself, they can do a benchmarking with other organizations and to determine what areas they are weak or what areas they can use to stay competitive out there in the industry. Practice guidelines. Organizations, they can set some of these practice guidelines as a standard of care, and the purpose of do that also could be to facilitate or help to minimize risk. With respect to some of these practice guidelines, may be very difficult to monitor some of the process within an organization or the ongoing activities with that particular facilities, and this tends to do what? To increases risk increases as the organization's departure from stated guidelines can be a source of the liability. So here are the high exposures issues have been listed out there, from organizations to disclosure of the information or withholding of the treatment. This is different from withdrawing, I think, of the treatment. Withholding of the treatment is just to stop treating the patient and let the cause take effect until maybe that particular patient is becoming improve his health or end his life. So they call withholding of treatment. And credentialing, this is the area again, looking at the individuals who are performing some of these or deliver some of these health services, if they are qualified to do whatever they say they can do. And then they do have some process over there of the credentialing. HIPAA, you're familiar with this. This is just protecting and safeguarding some of the medical records of the patients, medical records monitoring and clinical activities. These has been identified as higher exposures issues within the healthcare facilities or hospitals or doctors networks. All right, summary now. I think I have not talked a lot about quality, healthcare quality. How do we measure the healthcare quality? I'm going to talk very brief, and then we're going to summarize this. Healthcare quality is defined by looking at, I can say, 4 variables out there. The first variable is a structure that consists of the facility itself, if it's accessible to all the customers, and also the individuals who are disabled. Structure, having a structure that is a building itself is accessible. The building itself has heating and cooling system that is making all the customers who visit or coming into that particular building to receive the services, it's comfortable and has all the let's say it meets all the building code, the structure. And then within the structure itself, you can say that the hospital or the facilities has all the equipments that the hospital is required to have: running water, cleaning running water, lights and all that. And then it comes from the structure now, and the next variable is the process itself, that include the individuals who they're sitting at the front desk, the ability to engage in a very good communications, because in the beginning of this chapter we start talking about the good communications, the admission staff members, the lab tech, the individuals who are working in radiologies, the individuals who are working in the lab to check the lab work that has been requested by the physicians. They must have all the credential. That's why we say credentialing is significant when it comes to the process. And all these individuals, they have to meet the standards, guidelines, and policies within that organizations in order for the process to produce the good outcome. So the third variable is outcome now, and the outcome the outcome consists of the structure, the process produce a good outcome, such as stop, let's say, death, stop the infections, stop the disability, stop the numbers of the readmissions, and etc. and etc. And the fourth variable that with respect to the quality now in healthcare delivery system or healthcare services is the patient satisfactions in terms of patients-physicians relationship, in terms of the communication, patients with the relationship to maybe nurses or assistant physicians and all the individuals who they're working with at that particular facilities. So patient satisfactions fits in within or emerged in between the relationship between patients or customers and physicians, or customers and nurses, or all those individuals who are working within that facility. That's quality of healthcare. So it's measures based on the four variables, which is the structure, process, outcome, and satisfactions. And then that's what we say quality and risk management are overlap. So the risk, we measure all these risks that I've indicated there. The building has to be right, the process has to follow the standard guideline and the policies within the organizations to avoid, let's say, malpractice or the medical errors. So quality and risk management, they're overlapping. So risk managers now, their job is risk managers that can utilize quality techniques and reports to assess risk and recommended improvement by looking sometimes the action-oriented learning in terms of the rapid cycle improvement.